Hi, I'm Larry Bauer, Chief Executive Officer of the Family Medicine Education Consortium today. And we're excited that we have a presentation here by the faculty at Hunterdon Family Medicine in New Jersey. They'll be talking about integrative medicine, and I'm turning things over to you. It's your show.
Welcome, everybody. I'm Monica Meyer, one of the faculty at the Hunterdon Family Medicine Residency Program. Looking forward to talking a little bit, hopefully interactively with you regarding integrative medicine. And there's a number of colleagues with me who are also going to be presenting. I'll let you introduce yourselves.
I'm Lori Colpan. I'm one of the faculty at Hunterdon Medical Center. And I actually did my residency here, left for the military for a little while, and then came back and have been here for 15 years.
Hi, I'm Patricia Cross. I'm the program director here in Hunterdon, and I'm excited to be here with you today, and I can talk a bit about osteopathic medicine with you as well.
Hello, I'm Julianne Luco. I'm the associate director of the residency. And I'm just glad to be here tonight to talk a little about what we love about integrative medicine and some of the things that we've been learning.
Hi, everybody. Can you hear me?
Yep.
We can hear you.
Good. Okay. I'm Jess Mason. I'm one of the third-year residents, and I'm one of the chief residents as well, and I'm in the integrative medicine track, so I can talk a little bit about that from a resident's perspective, too.
Sounds great. I'm going to flip over and share my screen. I have just a few handful of slides to sort of focus our discussion here. So hang on a second here. Are you able to see my screen?
No.
We still see you, yeah.
You still see me. Okay, let's see how we can do this. So I'm not really seeing you at this point. Okay.
Yep. Did you try Alt-S?
No, I didn't. Let's try that.
Seeing the slides on your screen.
I have the slides on my screen, but I'm actually not seeing the Zoom. At this point, I have a blank Zoom screen here. Let's see. Is that any better?
No, unfortunately.
Not sounding like it. Okay. All right. So it's up on my screen here, not on yours, right?
Right.
Sorry about that. So let me try this. Okay. Let's try the share screen again. Okay. How about, yes, now you're seeing my screen?
No, but maybe I'll step into my office and see if I can pull it up and join the meet and do it from there.
Sure, we can try that.
I know when I share a screen, this is Denise, I have to have the document open.
Yeah, I have the presentation open here. So, all right.
We're all just learning, I think, at this point.
We are just learning. I've had this work pretty well previously. So while Dr. Cross tries to open things up on a different screen here, I thought we'd start with some of the general concepts of what is integrative medicine. So integrative medicine really focuses on the health and the wellness of an individual. It specifically is not a disease-oriented approach. So we don't think of our patients as, you know, oh, Mr. So-and-so with hypertension, but you really think of them more along the lines of the complete bio, psycho, social, cultural, and spiritual components of the person. To have a therapeutic relationship with your patient, you are part of the healing process. And so it's very much centered on the patient and practitioner relationship. So it very much works hand in hand with the philosophy we have in family medicine, where we build long-term relationships with our patients. We use all available scientific evidence, and we use all therapeutic options available to us, both conventional and complementary. And so this is one of the significant differences, which is that alternative medicine really means using things outside of and only outside of conventional medicine. Integrative medicine refers to using every available tool. So sometimes you need surgical interventions, sometimes you need pharmaceuticals, sometimes you might need acupuncture, and other times you might need some mind-body medicine. So you find ways to safely interweave and use things together. There are some key concepts which are important. One of the things that integrative medicine stresses is the recognition that the physician, the provider, needs to focus on self-care. It is not selfish. It is not self-centered. You cannot give that which you yourself don't have, and we are in a very demanding profession. I'm going to ask Dr. Lori Colpan to step in and to add some with respect to self-care concepts.
Thank you, Monica. So wellness is a very important part of everyone's lives, particularly in medicine. We have a very demanding and high stress field. We're dealing with life and death issues frequently. And the ACGME actually recognized how important mitigating burnout is, such that in 2017, they mandated that every accredited program, no matter what the specialty, have a comprehensive wellness program as part of their residency. So whatever residency you join, there will be a wellness program there. When we talk about wellness, there's lots of different facets to that. There are your physical being wellness. Are you exercising? Are you getting sleep? Are you feeding yourself nutritious food? There is emotional components to wellness. A lot of those you find in relationships. Are you getting time to spend with the people who matter to you? Are you making those important events in life? And that really that's the main way to, I think, fill a lot of that emotional tank. And then there's your spiritual side, which is not the same as a religious side. That can be for people, and that's wonderful, but really the spiritual part is finding your sense of meaning. So those encounters that you have with patients, those relationships that you make with patients, those fill us up and really boost sort of the spiritual side. Other things that people do for feeling that whole spiritual fulfillment are things like mind-body medicine, meditation, reflective thought, reflective thinking, gratitude journaling. Those are all things that help fill up those spiritual tanks. So one thing that we do at Hunterdon, and like I said, whatever residency folks go to, we'll have some kind of program, but we really do try to make sure that our residents understand what burnout is and what it isn't. It's not just stress, but it really starts to get into that exhaustion and depersonalization. How do you recognize the signs of that in yourself and others? And ways to mitigate it. We try to provide time for residents to bond with each other, filling that sort of emotional tank with relationships. And we explore different options for wellness through things like nutrition, through things like mind-body medicine, through learning about essential oils. And the idea is not that everyone should love every single technique, but by exposing folks to lots of different options, two things happen. One, you find things for yourself that you might resonate with and want to as part of your daily practice. And also then you're learning things that may work for patients, or patients may have tried and now you sort of understand what those options are. And that's basically our general wellness program, and just some concepts about the importance of maintaining your own wellness. There's a physician that we refer to a little bit, Dyke Drummond, who is the happy MD, and he often says, you can't give what you ain't got. And I like that statement a lot, because if you are running on empty, there's nothing left to give. So we want to always be cognizant of where our tank is full.
There's also good research showing that if you come into the patient exam room running on empty, not in your best self, there's some interesting studies showing that it actually has an impact on the patient and how quickly or slowly that they heal. Yeah,
I have
neat
to
stuff.
say, I find that to be 100% true. I've been thinking about this a lot, and it took me a while to embrace the concept of wellness and taking time to do certain things to make sure that you were well. But what I really find is I'm much more capable of having difficult conversations with patients when I'm in a good mind state, and that I'm willing to sort of tackle things and really go down, into the nitty-gritty with them in a way that I can't if I'm exhausted and I haven't eaten, and I have other distractions on my mind. So I do think it makes us better doctors.
Right, really a lot of the science. So, I hate to say that a lot of the what led up to the ACGME making this was, as we moved into this era of zero preventable medical errors, what they found led to medical errors. One of the root causes was burnout and physician exhaustion. When you're exhausted, hungry, hangry, however you want to say it, you make mistakes. And so
We all do, yeah.
that was actually part of the impetus for making this a requirement, really bringing this to the forefront for every specialty, that you're more likely to make an error if you're not caring for yourself.
Absolutely. So slowly try to work on developing some self-care strategies for yourself. And it'll vary from week to week and rotation to rotation. As Dr. Colpan was saying, sometimes it means you're just going to make sure that you've eaten 3 times in a day because you're on a super busy rotation. And maybe you've taken 2 bathroom breaks, but you made sure that you had those taken care of that day. And other days, you might actually be able to expand and set the bar higher and say, well, I'm actually going to be able to exercise this week, or take some time out in nature. But it's recognized that this is very important for all of us. So I thought I would give us some, like a framework for thinking about some of these integrative tools that you might like to learn about or use, whether for your own self-care or for your patients. So I like to break things down and just think about them in 6 or 7 broad categories. The first one would be lifestyle. And I'd really love if you want to either send things through the chat or turn your microphone on. What do you think of when you think of things that fall in the category of lifestyle that'll impact your health or your patient's health?
Diet and exercise.
That's great. Yeah. I think diet is so important. We're even going to make that one its own category. So let's throw in the exercise component there. And many times people think strictly, the 150 minutes of aerobic exercise, but really there's also a growing body of literature that says just moving and getting up and moving is really important. That may not be your cardiovascular piece, but it might be your break from sitting and studying, or that which helps you find some relaxation for a few moments. Yeah, terrific. What else?
Sleeping.
Absolutely. Yes.
That's a first light sleep.
Yep. Big fan, big fan. Yes, restorative sleep. This is when our nervous system and our immune system resets. I'm sure we've all pulled all-nighters, and you're just not quite the same next day. And if you do it day after day after day, we're really not the same by the end of the week. And if we don't see it in ourselves, ask a loved one near you. They'll tell you. Anything else that fits under lifestyle? How about things like community and supportive relationships? Everybody goes through tough times, and it makes a difference whether you have someone that you can lean on, or just bounce ideas off of, or just share whatever struggles you're having. It makes a big difference. There is some research that shows it's very important that you have 3 people in your life that are close enough to you that you can really share important things with. Folks who are by themselves or don't have any other people that they can rely on when the going gets tough, who are suffering from loneliness, actually have higher chronic diseases. They have a higher rate of chronic diseases. So not something that we necessarily ask. We're starting to ask in our elderly and recognize this as an independent risk factor, but I think it's probably true throughout the lifespan. Any other things we might want to throw under the lifestyles category?
I was thinking routine and habits, like your hygiene, what you do throughout the day and all that.
Yeah, tell me a little bit more about what you're thinking there.
Just some people, like especially like I guess with like who have depression, or people that have any kind of like lower if they're experiencing any mental health issues, sometimes they'll forego showering for days, or they might not wash themselves properly, or just kind of feel like, oh, what's the point, kind of thing. And some of that's to look out for.
Yeah, I think that's actually a really good point. And not just restricting it to those with mental health issues, but I would say that for all of our mental health and well-being, we train our bodies, and our bodies are used to cycles and the routines that we put them in. And it's part of your wellness. Your body is used to getting up at a certain time of day. It's used to, getting nourishment at certain times of day. It's used to having breaks at certain times of day. Yeah, I think that's a good one. That's a real good one.
And to tag on that, taking care of yourself, making sure you do things like go to the doctor. And I don't want anyone to answer, but when's the last time you were at the doctor for stuff? We profess that that's important, and we're not fabulous at it. The dentist.
Right.
All those things that we need to keep up, yeah.
Yeah, good point, good point. And so somebody talked about nutrition. So let's make that its whole own category. Hippocrates said, let food be thy medicine. And there's a whole movement now to consider food as medicine. What does that mean? Why is it good for us? Why is it important?
Because of the amount of macro and micronutrients that are found in food, vitamins, cofactors, and all that.
Cool. Why are they important?
Because you can, sometimes if you eat healthy, you can eliminate a lot of health issues. Like
yeah.
mentioned, for example, like eating less salt is very good for the patients.
Absolutely. Yeah, I agree wholeheartedly. What kinds of diets do we tend to recommend? I actually don't like the word diet. I prefer the word nutrition or nourishment. If we're thinking it as a conceptually as something that helps to sustain health and our wellness. What kind of nutrition would you recommend for a patient? How about for us, actually?
Low carb, high protein diet.
I guess there goes my coffee and donuts.
Not my coffee.
Oh, okay. Actually, I think I just saw an article that said certain amounts of coffee can be beneficial for the nervous system and for the immune system. So Dr. Croft, you're safe.
Thank you.
All right, other ideas?
How about like the DASH diet for hypertension, like high fiber,
Yeah.
high fruits and veggies?
Yeah, absolutely. Other thoughts?
A balanced diet.
What does that mean?
So when you said like there goes the coffee and donuts, like you can eat the coffee and donuts, but in moderation, as long as you also get your fruits and veggies.
Okay, all right, I like it.
And speaking of moderation, it's not only what you eat, but how you eat, and sitting down, not looking at your screen in order to eat your meal helps reduce portion sizes, and it helps you spend time with those you care about. And those are all aspects of wellness that are tied to food.
Absolutely.
Also, food insecurity.
Back to that connection, right? Yeah, love it. Terrific. Other thoughts?
The flip side is food insecurity and the idea of food as medicine, as in food prescriptions, which is hopefully someday will be more widespread.
Terrific. Some great ideas. Some of the other diets, these are all fantastic ideas. And just that it's forefront in our mind and we're starting to think about it, not just a prescription, and that it may go hand in hand, right? You might make some dietary recommendations along with the antihypertensive for the patient with high blood pressure, not one or the other. I will often think about recommending a Mediterranean type diet. So there are many different Mediterranean type diets, but in general, heavy in nutrients that come from plants, lighter in nutrients that come from animal products, and certainly light in sweets, treats, candies, and those kinds of things.
To tag on to what our last student had said about the food insecurities, it also points to the need to really work with your patients as to what they are able to afford. Unfortunately, our poor quality, high carb, high calorie foods are cheap. And so there are ways to get some fresh and healthy food, knowing what those resources are in your community and being able to help patients. But asking that question is so important because too often patients don't want to, bring up the fact that they're having trouble affording some of the more nutritious fresh foods.
Yeah, and I know for us it's been interesting kind of looking at it a little more from the community perspective. And as we started asking those questions more, actually being able to identify by zip code in our county where there are a higher prevalence of people who are having trouble affording their food, and then trying to put the right resources, to your point about like prescriptions into place where certain food banks would have fresh foods where we thought they might be needed more. So there's definitely, it's such a complex issue. And so beyond just the doctor's office. But it's nice that I think everyone's becoming a little more oriented towards a team approach and recognizing that we have to all work together.
Absolutely. Yep. Great ideas. Very definitely. So the next category that I think of is manual therapies. So more hands-on therapies that we can provide for our patients. Anyone have any ideas what might fall under this category?
Acupuncture.
You might consider that in this area. It also fits in another area. So good start. Okay. Do we have any osteopaths on the call?
Yes, that's what I was thinking. But I didn't know if that was also under the other category. But OMT or osteopathic manipulative treatment could be an option, which takes into consideration the musculoskeletal system and how if something is off balance, then that can create off balance in other areas of your body as well. And sometimes correcting that misalignment or that tight muscle can then alleviate the problem that is going on in a different part of your body as well.
Thanks. That's a great explanation. Yep, perfect. Dr. Mason, you want to talk a little bit about the OMT component?
Yes. So, and I'm sorry if there's road noise in the background, my door's open. So if you hear anything, that's why. So I do a fair amount of OMT in the office, and I feel like we offer a pretty good amount throughout the residency as well, both for MDs and DOs. Dr. Meyer, I know you do some in the office as well.
Yep.
And so we have multiple different sort of opportunities throughout residency. First, we have formal didactic sessions that happen approximately once a month. And that's for everybody, MDs and DOs, and we all get hands-on and learn some like pretty easy, straightforward techniques. And then the DOs get to teach the MDs how to do some of the treatments as well so that we can all use them on our patients. We also have sports med clinic. That's again for both MDs and DOs. And it's run by 2 osteopaths. So we do a variety of sports medicine type techniques there, but we also are doing a large amount of OMT, and we have a lot of repeat patients who come every month or so. And then I also do a fair amount in the office. I do it on many of my patients, whether it's for a formal osteopathic evaluation or just something I add on to their visit for a cold. It's really nice to be able to give someone something for a viral upper respiratory infection when they come into the doctor's office wanting that antibiotic and you really don't want to give it to them. They can leave feeling like you did something for them with just a couple pretty straightforward techniques, and they actually help. I use them all the time.
Can you mention a little bit about where you've used OMT in the hospital? Because I think that's pretty unique, especially recently.
Yeah, I forgot about that part. So within COVID, Dr. Skillen, she's one of the administrators and part of the residency program. He developed a COVID OMT treatment program. And so he was going into a lot of the ventilated patients and doing treatments on them. And then I use it on hospitalized patients as well, whenever I'm either on service or whenever there's an interested resident on service. We can treat COPD, we can treat people who come in for back pain, constipation, really anything. There's a lot of gentle techniques you can do on hospitalized patients. And I definitely think our COVID protocol was a pretty unique thing that we got to experience. That was pretty cool to see.
Anything else you wanted to add, Dr. Croft?
Yeah, I think Dr. Mason did a really nice job with that. But what I would say, in this past year, just so much with the hands-on, and I think thinking the combination of almost community and hands-on medicine that OMT allowed us to provide during COVID, especially when we were really limiting the number of people in and out of patient rooms. That it was an opportunity to spend some real time touching a patient that in many instances they weren't getting throughout the day, unfortunately. Right. And I think that's also true in the office as well, that there's just so much healing in touch that we're really fortunate to be able to share those tools and have more providers using them.
Absolutely. Can we think of any other manual therapies that might fall in this category?
Would physiotherapy also be included here?
Yeah, I think so. That's a great suggestion. Yep. How about massage therapy? I'm sure we could all use a massage after spending time in front of the screens here.
Yes.
Watch your body position, don't hunch, don't slouch too much. Yeah, be aware. Probably the next category I can think of, Dr. Colpan, I think you started to mention this one in context for our own health, and that's mind-body medicine. This is sort of a very big, broad area. What kinds of things fall under the category of mind-body medicine?
Like meditation.
Yeah, what kind are you thinking of?
Yoga. I'm not sure.
Okay, yeah, absolutely. There's many different types of meditation. Any other thoughts here?
Self-care.
How about spirituality?
Okay, yeah, your spirituality and prayer, that can actually be a form of mind-body medicine. Yeah, you're right. Yep, good. What else?
Self-care.
What are you thinking? Be more specific.
So sort of like engaging in those types of activities, you know, that it's sort of in a way spiritual, but also just like taking care of yourself. So like if you like getting your nails done, or if you like doing some activity like going hiking or things like that, and taking the time for that.
Okay, I see what you're thinking. Yep, so it would fall partly under mind body and maybe partly under our lifestyle. Okay, yep. Any other types of
I'd also like
mind-body
to bring up
medicine?
I'd also like to bring up exercise as a form of medicine that contributes both to mind wellness and physical wellness.
Mm-hmm. Absolutely. Yeah.
I think it's cognitive behavioral therapies, like reframing how you think about certain things.
Absolutely. That's a great suggestion. Has anybody heard of guided imagery? So guided imagery, similar. Go ahead. I think that was Kia.
Yeah, sorry, I didn't mean to interrupt. I was also going to bring up mindfulness in regards to meditation and yoga, and guided imagery is the type of mindfulness that people can practice.
Absolutely. And then there's mindfulness-based stress reduction, which is a formal program of mindfulness. Yep, all good suggestions. Anybody heard of clinical hypnosis? Might sound scary. It's not really somebody funny standing on the stage, you know, jumping on one foot, but actually can be used therapeutically for easing pain and improving anxiety, helping with asthma, helping with irritable bowel. So it's a technique that you can teach yourself and you can teach your patients. Similar to guided imagery. Yep, a lot of good things in this category. Let's see. Another category might be whole health systems. So around the world, every culture has developed systems of health and healing. And there are some pretty big healthcare systems that have been around for centuries. Any thoughts what might fall in this category?
Like Ayurvedic medicine in South India.
Absolutely. Can you tell us anything about that?
It's basically just like the practice of using certain herbs or certain kind of, I guess, plant-based medicine endemic to that region.
I think that's part of it, but I think you were earlier alluding to schedules and routines, and that's as important in Ayurvedic medicine as the foods that you eat. So it really is one of the original preventive health forms of medicine around the globe and around the world. And I believe yoga is part of the practice of Ayurvedic medicine. So that brings into it some of, for some it's the spiritual component, for some it's the energetic component, it's the movement component, but it's all combined together. Other suggestions or thoughts for whole health-based systems?
Chinese medicine and medical acupuncture.
Right, so that's another one. Traditional Chinese medicine has been around for thousands of years, and there are a lot of parallels between traditional Chinese medicine and Ayurvedic medicine. Again, the practitioner looks at who do you spend time with? What are your routines throughout the day? What foods do you eat? Do you seek heat or cold? Are you damp or are you dry in your skin and in your tissues? And part of the treatment therapy includes acupuncture. Part of it includes a movement like Tai Chi. Part of it includes a spiritual component or energetic component called Qigong. Part of it is the type of foods and nutrition that you are recommended. So again, it's a very holistic approach to your health as well as how you are to help your body heal itself. Absolutely. There's one more area that I'm thinking of just off the top of my head here. I don't know if anyone's heard of naturopathy or has ever seen or gone to a naturopath. Any experience with that?
My family goes to a naturopath.
Terrific. Tell us more about that.
Well, naturopathic, they focus more on like the I guess the plant-based medicine or alternative ways to treat illnesses instead of using the traditional allopathic medicine. They'll treat something like, I guess, by different methods, like certain medicines that they'll create, or like, I wouldn't say concoctions, but like mixes of certain types of plants. And they'll say, if you drink or eat this certain type of food, your swelling will go down, or this infection will go down. Like for example, my uncle had he had an abscess, and he tried to go to a naturopathic doctor, and he tried it for a few days, and the swelling actually went down.
Wow, cool. Perfect, thank you. Yeah, that's a pretty good description. Very good. So that kind of brings me to another category, and that would be botanicals. What kind of things fall under the category of botanicals?
St. John's wort.
That's a very specific herb. Yes, absolutely. What else?
The latest crave, I guess, has been like the thing with apple cider vinegar and to treat high cholesterol. Like a mixture of like apple cider vinegar or pink salt. I've actually tried that. My family as well. It actually works. It's like a mixture of Himalayan pink salt, lemon, and like apple cider vinegar. And if you just mix it, it'll treat like common illnesses like stomach aches, or like it'll lower your cholesterol too.
Everything that's old is new. That's a remedy that has been around for decades. And it's actually very interesting to look up some of the literature and see what kind of evidence exists around that. So you might find that interesting. See what you can find when you look that up. There's a mix in terms of what you find. So what else falls under botanicals?
I might be pronouncing this wrong, but is it ginkgo?
Ginkgo, yeah, that would be a botanical, right. So I'm hearing names of a lot of different herbs. That definitely falls under the category of botanicals. I also think of supplements. And I would actually also think of essential oils. They're all derived from plants, and they're actually highly concentrated forms, and many times are not used properly. They should never be used directly. They should be diluted when they are in use. And you might need to be careful for children, not always appropriate for children. Shouldn't be diluted in oils for kids, and should generally be diluted in water when used for children. But also can be a component of your treatment plans. And has anyone heard of homeopathic remedies? Anyone know the difference between an herbal and a homeopathic?
From my understanding, homeopathic medicine has to do something with diluting certain extracts from plants in order to make it work more effectively?
So it's a completely, that's a pretty good start. It's a completely different philosophy where you start with an extract from a plant, not necessarily a plant, but certainly some are plants. And you make serial dilutions until you have diluted it so much that there is less than one molecule of the original substance. And they call these things remedies. When you go to the health food store, you can tell the difference between a homeopathic product and an herbal product if you look at the concentrations. And so things are so diluted that they are often have an X or a C, so standing for 10, you know, the Roman numeral 10 or 100, which designates what dilution or diluent that a particular dose has. And if it's an herbal product, it will be in milligrams, grams, milliliters. And many times the patients that we are advising really don't know the difference, and many docs don't know the difference actually. So just an important distinction there. Let's see, other categories. I can think of one more big category that would be energy medicine. This might include things like Reiki. Has anybody experienced or heard of Reiki? Sounds like that's a new one for most people. So Reiki is a practice where you are, depending on the style and approach, some people are actually touching the body, and other times they are simply taking their hands and hovering gently over the body and sensing different fluctuations in an energy field that is coming from your body. It can be used as a technique for pain management, for stress reduction, for anxiety. So it's an interesting thing to try sometime. And I think we alluded earlier to Qigong, which is more the energetic and spiritual practice component of traditional Chinese medicine. Some would call that an energy medicine. And therapeutic touch would fall in the category of energy medicine as well. All right, I think that kind of goes through the basic categories of some of these additional tools that you can learn about, learn the benefits, learn the risks like we do about everything in medicine, and decide where it can be an adjunct and can be applied either for your own health or for that of the patients that you're caring for. And I thought maybe, go ahead.
I was going to say, do we want to have maybe Dr. Mason talk a little bit about the integrative medicine residents that we have here? And then
let's do that.
We can open it up to questions of, you know, what do you guys want to know about the practice of integrative medicine within family practice?
Sounds good. Dr. Mason?
Okay, so we have an integrative medicine, I guess, track, we could call it. And we're affiliated with the University of Arizona. So the didactic portion is primarily online and a lot of self-directed learning. And then we meet in person at least once a month, if not more, where we do either integrative cases. So we go through sort of all the categories we just talked about now related to a specific disease and discuss how we could treat a disease from an integrative approach. We also sometimes do hands-on things, like we've made balms. I believe the year before I started, you guys made tinctures.
Yep.
We're
up for that this year.
I don't quite know what it is yet, but it's usually something from Dr. Meyer's wonderful garden that she brings in. And then we also have a fair number of practitioners in both offices, so we are able to come up with integrative treatment plans on our real life patients too, which is pretty great. And then we have lectures for everybody, even if you are not in the track. So everybody gets a little bit of integrative medicine, even if you're not doing the full formal didactic track.
Last week we did our annual field trip to a local health food store. We've partnered with the owner of the health food store, and once a year we go and do a scavenger hunt in the health food store. And that gives us an opportunity to learn a little bit about herbs and supplements, some of the labeling, some of the regulations for production, manufacture, and distribution in the United States, because it's very different than pharmaceuticals. We learn a little bit about the difference between the homeopathics and the herbal products. Just have fun exploring in the store.
It was a lot of fun.
So let's hear from you all. What kinds of questions that you have? What would you like to know? What's piquing your interest?
Just give you a heads up, there are 15 minutes left.
Thank you.
Hi, I'm Shika Patel. I'm a fourth year from Rowan in Stratford, New Jersey. And I wanted to know specifically about the program, since we talked a lot about wellness and things like that. What kind of support is provided to the residents, and is there any kind of formal mentoring available?
Specific to wellness?
Wellness, and also in terms of like the curricular aspects and also the clinical aspects of the program.
Well, I have to say, this is one of our areas that I think we feel like we do well in. All of our residents have an advisor assigned to them who is an assigned support person, but of course they often find their own mentors as well. So I think people often end up with multiple mentors, really. But we sort of, really our goal is to be a rigorous program, but really to be a supportive program, because we really think that that's when people excel, is when they feel supported. And sometimes when actually, if people are having any challenges in any ways, we often find that we can help them best by really trying to understand what's going on with them at that time and help them work through that, because residency is hard. You know, it's not an easy thing, and I think support is so critical, and sometimes that support is in having fun things with the other residents, but sometimes it's about serious conversations and being able to provide that. And if people need more than that, we certainly have other people within the system, you know, who can help support the residents. I think Trish may know a little more about that.
Right. So at Hunterdon, and I would say at many hospitals and residency programs, there's a 24/7 employee assistance program. Our residents have complete access to that. And actually the director of that program has regular conversations with our residents to let them know, you know, what support services are out there. And what's nice about that is it really is anonymous for the resident to be able to seek that, separate from, you know, reaching out to their faculty. But of course, you know, the faculty are very much open and supportive to be available to our residents. We also want to make sure that residents have time to get their medical care. It's one of the questions that we ask. All our residents do a self-assessment at least twice a year formally. And part of that assessment is really, what is your wellness plan? What are you working on? Do you have a primary care physician? Not that we need to know any more details specific to that, but we just want to make sure that you're not letting it go, that you're still getting your dental care through residency, all the important things to stay well. Oh, and nutrition, you know, I should probably just bring that up. It's one of the nice benefits too, is really being able to access food in here at the health center. I feel like the cafeteria is pretty good. I should probably let Jess Mason talk more about that. As a resident, it's easy, you know, it's better to hear from them. But, you know, goals that we've had when we talk to our residents, you know, we have snacks in the lounges, but they'll ask, you know, can we make them a bit healthier? And we all agree, yes, let's improve on that.
Yeah, so I agree with what everybody's been saying. We have the assigned mentors, but I mean, really as a third year now, I feel like almost all the faculty are a mentor of some aspect, just because everyone's so open. They are constantly checking in to see how you're doing. They're asking not just about you, but your family, your friends, your pets, like whatever. That's always the
important
question, is like, how are you doing? Are you sleeping? Are you eating? Okay, now we can talk about your rotation or whatever's next. But it really is, your wellness is the most important thing. And if you're overworked or they get the sense that you're getting exhausted, then, you know, arrangements can be made with other residents. Everyone understands, everyone's in the same boat. And really, this residency, we all have each other's back. So if you have to trade a call shift with somebody just to get that weekend off when you really need it, that's something we can do easily. So we also make our own calls, so that's a big benefit that helps with wellness, is that you can make it to weddings and birthday parties, and if you want your birthday weekend off, you can have your birthday weekend off, and it's not a big deal. For my class, that was a very important thing.
But it's those little things that matter, right? Yeah.
What other questions do people have?
Guys, my name is Lincoln. I'm a fourth year from Ross. This is a question about the program, but just in general, how often do you guys see yourself using the alternative medicines and like, as opposed to, you know, prescribing drugs and stuff? How do you find like that? What do you feel like is more effective?
So I think that that's a really hard question to answer. And I think my job as a physician is to really work with the patient and their viewpoint of what they're interested in doing. I don't see it as an either or. I will frequently talk about and spend time counseling. We talked about lifestyle and we talked about nutrition. And I think that that's the cornerstone for a lot of chronic health conditions like hypertension, diabetes, depression, osteoarthritis. I mean, that's a bulk of what we see. So that's a component of what I'm making recommendations and using motivational interviewing to see what kinds of changes that a person is ready to make. And because you have and invest in a long-term relationship with a patient, it's not just saying, change your diet. It's saying, so what part can we work on? Can we work on not drinking soda after 9 p.m. as opposed to eliminating it all the way? So maybe between now and when I see them 3 months later, if they feel that's something they're ready to do, if I'm there to support them, they are more likely to be successful. And ultimately, that's getting them towards a better control and feeling better. But it's in conjunction with them, and it's also in conjunction with whatever medication that we happen to need at the same time. So it's very much not an either-or situation. It's knowing how to bring both sides and interweaving both sets of tools for the patient's benefit.
I want to echo that what Dr. Meyer said. It's absolutely integrative. So, I mean, I would say I use it a lot. Doesn't necessarily mean that I use tons of herbals. I do use some, but you know, when someone has had a cardiovascular event and has high cholesterol, they need a statin, and that is where I'm going to try to move them towards in terms of a traditional medicine. But why did they get that blockage, and how can we help them through lifestyle and nutrition also decrease the risk of another event? And you know, to then bring that even younger, a lot of what you know, this whole body approach to medicine is have them, what can we do earlier in life so that they don't build that plaque in the beginning? And so maybe I have, so I'm always talking about that lifestyle approach. But maybe I have, you know, a 30-year-old with an LDL of 170 who, you know, their 10-year risk is like very low because they're only 30. They don't want to use a statin, but they've got terrible family history. They want to use an herb. Maybe for them, for some red yeast rice is going to be a good option. So it's very individualized to the person.
Along with getting them to be more active, because they'll start making those changes, and those changes take years to show benefit.
Yeah.
So absolutely the combination. Yeah.
Thank you so much.
Sure. What other questions can we answer for you all?
Hi, I'm Rachel. I'm a fourth year from Temple St. Luke's. I've learned a lot about lifestyle medicine from Dr. Grega. She trained at Hunterdon. I think you guys might know her.
Yes.
Yeah, she's amazing. But I've learned a lot from her about a whole foods plant-based diet. I'm wondering if that's something that you guys talk about in integrative medicine as well.
Absolutely. So a whole foods plant-based diet has many similarities. We were talking a little bit about the Mediterranean diet, so there's a lot of crossover there. Absolutely. So again, you have to meet the patient where they're at. And if they're used to going to fast food restaurants for 5 out of 7 dinners in a week, telling them to start with a whole foods plant-based diet is just going to fall flat. So you have to meet them where they're ready to start making changes and work with them little by little by little, because that otherwise it just seems like too huge of a hurdle to get there. But yep, very definitely. Yes, we remember Dr. Grega. Absolutely. She does a great job.
She was with us last year she gave a presentation.
I heard, yeah, she actually pointed me towards you guys to look for residency.
Good.
Excellent.
Absolutely.
She does such a remarkable program of bringing nutrition to schools and talking about this at the earliest levels, which that's really where we want to start making that impact. So I'd love to do that as a future project.
It would be a great project, you know, having the students plant gardens at their schools and learning to eat the food that they've grown. It's so much easier to excite children about food when they've seen it through the entire process, and then bring it home and say, this is what we're eating. And you can really make change from the ground up with a family that way.
Yeah, I was able to go with her to some of her school programs. The kids just absolutely love it. It was so cool to see.
Yeah.
And they get so excited and engaged. Yeah. So I know we have just a few minutes left. Yeah. So don't be shy. Get those questions out.
Could I ask, I'm calling from Charleston, South Carolina at MUSC, and my name's Carolyn. And I don't see a lot of integrative medicine incorporated into our curriculum thus far. And I was wondering where to start. Is it with nutrition and exercise? Lots of our patients have multiple comorbidities and would really benefit from preventive medicine in the community. So where would you start?
You're talking starting with a patient or start in terms of your own training?
I mean, start with patients and with a community to start integrating integrative medicine.
I think with any of those factors, and you might want to actually work with community leaders, and that might be working, if you're interested in the children, then work with some of the teachers. Where do they see opportunity? Is it in getting them moving and starting some, physical movement and a walking program? Or is there a local farmer that would be interested in partnering? So again, rather than looking at it just from your area of interest, see where you can find community partners and start building on that, because any of those areas will help and will improve chronic health conditions.
Thank you. We do have some wonderful community partners around the area who do gardens, who do nutrition, who do exercise programs, but coordinating between all those different efforts it seems like it would be very challenging.
So maybe start with one and get one connection to work and build on it from there. And it might be bigger than you in 1 year. This might be, a project you start with, and then someone else carries it on in subsequent years. So start with one partner.
Thank you.
I'm going to offer a recommendation for a book. If folks are interested in this area, you should read Wayne Jonas's book, How Healing Works. He talks about the placebo effect and what it is. And it's just a wonderful read for everybody who's interested in a holistic approach to, from his perspective, what he's doing is renewing the biopsychosocial model and bringing it up to date, so to speak, with all the science that's has occurred over the last 20, 30 years. So our time is now come, and so we'll have to part ways. I want to thank everyone at Hunterdon for your presentation and your leadership, and to tell the residents, or the students, who are here. This is a storied program that has sustained since the beginning of family medicine a very high quality of education and community, because wherever I go and I bump into people who are from Hunterdon, they're very proud of being part of that community. So I commend all of you for what you've done.
Thank you.
Thank you for having
Thank
us.
you very much. Thank you for having us. Thank you all. Be well.
Thank you,
Wow,
students.
Thank you so
for
much.
coming.